The purpose of this video is really just to capture a unique perspective in the Sundre community regarding the COVID-19 pandemic.
We've been incredibly well prepared for if we were going to have COVID patients. We've run through SIMS for the last 16 months.
As soon as a patient comes in with any shortness of breath, chest pains, things that we would normally just go in and do our jobs, no mask, no gown, anything. Now it was like you wipe everything down, you clean everything, you only take in what you need, and you're fully gowned, you're masked, you're got your face shield on, and it looks a little bit hazmat-y almost walking in.
A lot more time has been taken up before you can actually get to a patient because of the screening, and if you have to put on personal protective equipment and taking it off. Everything has just slowed down because you have to protect yourself first.
And I remember one staff saying, I can live with wearing a mask, but it was the eye protection that's so hard. You're trying to, it would fog up, and you're trying to start an IV, and we're working with pediatric patients, and we're working with palliative patients that have fragile veins, and it's hot. I remember one time one of the physicians had all the stuff on and was working on a critical patient, and he took all his PPE off, and his uniform underneath was just drenched, just dripping wet.
Working in a hospital, I think we have a bit of a benefit because we see people who are really sick, and we see how that stuff protects us in that room, because I can go in and deal with 10, 20 people in a day who are extremely sick, and I come out just fine.
Everybody heard that there was possible thefts of masks and PPE and stuff, and so facilities went into locking that stuff up.
Because of the COVID, it means that we're wiping things down 3 times a day, plus all the isolation cleans that get called upon us, either in a merge or on the acute.
The little things that you don't realize you have to do. What's the temperature of our washing machine? Does it get to the enough temperature and the right cleaning to be able to clean properly, kill COVID and all the other bugs? Can we wash the stuff on site if we run out of PPE?
The girls go above and beyond. You got to treat those rooms every day, and each one of those rooms like it was a COVID room.
In some ways, I felt probably the safest at work than I did anywhere else in the community, just because we all wore our PPE, housekeeping staff were cleaning everything. Like, you never see them not cleaning something.
But there's a lot of people that are frustrated and angry because they don't understand the rules that I have to follow in order to keep everybody safe. You can't just come in to the hospital. You need to be screened. This is why you need to wear a mask. This is why I'm not allowed to let you go out for a pass. This is, why I'm not allowed to have all of these people come in and visit.
That was kind of the scary part of it. You never knew which patients were going to be virtually totally fine, apart from a cough and maybe some shortness of breath, and which ones were going to be crashing.
And when it first started, when we didn't really understand, I guess, the whole virus, there was total fear for going home, and am I going to make my kids sick? Am I going to make my senior citizen mom sick? It's horrible. And I can't imagine what it would have been like for people who were sleeping in trailers and not seeing their family. But we totally had a plan of, okay, if I get sick, this is what we're gonna do. My kids would have gone to my mom's house and stayed with my mom, and I wouldn't have seen them. And as a single parent, that would have been devastating. So explaining to your kids what potentially could happen is horrible.
For me, my husband did end up getting COVID, so which meant I had to stay home, which meant then the girls had to cover my shifts. So it was a lot of work for them to, all you have is one person missing, and it just throws the apple cart right off the road. But they did brilliantly.
I just can't say enough about the team here. I remember we had one incident where we thought maybe some of our staff were exposed to COVID, and we had to put them off. We put out the call to all of our staff. We have 50 shifts to fill, and that's That's not an easy thing to do with a rural hospital and the limited amount of staff we have. In one afternoon, all the staff had replied and we'd filled 50 shifts in one afternoon. And that just goes to show you the collaboration and the teamwork and the get behind your hospital that this community, the staff here, really have.
I've seen some young people, my sister being one of them, actually hospitalized with COVID at a very young age, super healthy person. So it's something that when that happened, I was like, okay, it really can affect just about anybody, but I've always felt a really big responsibility as a healthcare professional to take care of patients. Like, it's not a profession where you can be selfish.
When I think about what other people have had to go through, we've been lucky. My sister's a nurse. What she's had to deal with is far worse than what I have had to deal with here. And yes, I'm emotional about it because the last 16 months has sucked. It's been horrible. And you can only handle being called nasty names by the public for so long. And you can only handle being told that you're a sheep for so long. And everything that we have done for the last 16 months is disregarded by the general people out there when they're telling you that it's all a hoax and it's all, you know, a huge social experiment and whatever else. Like, kind of done with it.
So I can appreciate where they're coming from. Do I think it's the smartest thing to not get vaccinated? No. I think one thing people don't tend to realize is, yes, COVID is a new virus, but the family of viruses it's from isn't new to us. So yes, it's a rapid vaccination. Like, the study is amazing, and the speed at which we got that vaccination is incredible, and I understand how that can make some people nervous. I think it's, though, important to take time to actually look into things and, you know, not just be like, oh, this one person who I know is a nurse said it's probably not safe, so I'm not going to take it, right? Look into it for yourself. Recognize that all this research, yes, it's sped up, but that's what happens when you have virtually every country in the world throwing money towards it and putting the effort together, and that's the kind of work that we can do as humans when we choose to collaborate and work together. And
we're going to be getting the follow-on with the mental health for a good length of time, and I think that's probably going to be the biggest problem. It's people have got sort of fear that's built into their day-to-day lives, producing massive amounts of anxiety. Perhaps it means that people are going to be better at coming forward and saying, I'm not coping, but it's going to take a long time for us to get back to being so-called normal.
Our outpatient department was shut down, which is half of my caseload. And so suddenly we were all kind of maybe looking for things to do. I'd mentioned to our site leader probably one of the positives of all of a sudden having all this time was it coincided with the neuro rehab units in the cities being shut down. So we had probably, I think, a couple patients anyway that were transferred back here that normally we would have never seen. So we were able to see somebody from like early post-stroke where he wasn't able to sit up all the way to walking and going home. So it was, yeah, it was hard physical work, but it was super fun and super rewarding.
How did that feel for you?
It was great, yeah. And it worked because I always get emotional. Anyways, it worked because he worked so hard, right?
I had a patient and then he came in for an x-ray, and I did the x-ray. At the end, he's putting his jacket back on and he's like, I have a question for you. And usually that's something related to masks or COVID, or like, you know, they want to know something and they're a little upset. So sometimes you're not really sure what you're gonna get. But he asked me if I'd gotten my vaccine. Yeah, and I was like, yeah, I actually have. Why, do you have any questions about it? Because that's what we get a lot as well. And he's like, no. And he leans over, he's like, but I get my vaccination after this today, and I'm so excited. I had to tell someone, and it was just the sweetest thing. And then he started telling me about his grandkids and how, you know, he hasn't gotten to see them, and he's just so excited. And just, I think seeing that, because seeing it as healthcare professionals, like, I mean, I teared up when I got my first dose because it was just like, okay, finally, we're getting there. But to see somebody in the community feel the joy that that can bring, it was just, I'll never forget that.
Thank goodness we've had no COVID outbreak in the hospital, and I have to say it's probably because of all the staff doing their job, everybody helping each other, making sure that everything, you know, even when we're not around, nursing or wiping stuff down. So it's a team effort.
When you think of some of the other places and some of the other absolute horror stories that nurses and doctors and patients have gone through, we've been really lucky. Like, we've been inconvenienced, where other people, it's been absolutely tragic.
So overall, the population at large worked together to try to make sure that this new pandemic did not actually infect as many of us as it potentially could.
And I've actually had emails from patients, and people have come told me face to face that it didn't matter how much those staff were running and were getting pulled in all different directions and putting on all that PPE, they always had a smile on their face.
If anyone's interested in learning more about the history of Sundre, to come see us at the museum, and that this project will become part of our formal archives in our collection. And we're just so thankful to the Myron Thompson Medical Clinic and all of their staff and volunteers for helping us document this period of time.